Hello, coders. Good morning, good evening, good afternoon, all depending upon where you're joining us from. A warm welcome to you all. So, before getting started, I just want to quickly confirm, can someone let me know how do I sound? Is my audio clear? Please let me know in the chat. All right, thank you, Miss Mills, for letting me know, and Miss Catherine. So today, who all are there with us today on live session? Okay, let me know in the chat. So we have, let me go through the chat. We have Miss Mills as always. Welcome, Miss Mills. We have Miss Tyree. And who all are there? We have Star Wars Girl. She's also one of our intern. And hi, Patty. Hi, Mickey. And I'm just going through them. We have Becky. Hi, Becky. Okay, Miss Veena is here. Hi, Miss Veena. Okay. All right. So I think a lot of students are joining the session now. So once again, a warm welcome to you all. I hope you all are doing great, doing good. Yes. And also continuing enjoying these sessions. And I've been going through your feedback as well, coders, and I'm really glad to hear that the sessions are helping you all and you're finding them engaging and useful. So that means a lot to us, and we will keep building on that momentum. So without taking much of your time, let's jump right into today's CPT guideline mastery session. So first of all, let me read out the copyright. CPT Copyright 2026, American Medical Association, all right reserved. CPC is a registered trademark of AAPC. The AAPC content found within this presentation is a copyright of AAPC. Keyword concept FTR, CHON, AMCI FAB 7, AMCI ICD 10, Flip Tab, and MCG are the trademark of AMCI. The credential CPCC, RCCOC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credential. The credential CCA, CCS, CCSP, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credential. So coders, before we start today's session, a quick reminder, a gentle reminder. I would like to request all of you to please make sure to fill out that survey form towards the end of the session, and also let us know how you feel about our classes. We Today also, I think we have a pretty good number of students attending the session and also interacting in the chat as well. So but usually we get lesser number of the submissions of the submission forms. So please make sure to give us the feedback and let us know how you feel. And the best part is it will take less than a minute, so please make sure to fill out the survey form towards the end of the session. Okay, all right, got us. So, for today's session, we are going to dive into the thyroidectomy and strabismus surgery coding, two very important and commonly tested topics in your uh, board exams. So let me tell you before that, let me tell you something, coders. This topic was actually requested by one of you through the survey form. So thank you for that, and we truly appreciate your input. And this is exactly why I always say, please make sure to fill out the survey form, because we are listening to you all and we are shaping the session based on what you want to learn. All right. Okay. So first, let's look into the thyroidectomy procedure coding, and this topic can be found in the endocrine system chapter of your CPT book, specifically under the code range 60,000 to 60,699. So that's where, sorry, 60,300. That's where you will find the thyroidectomy procedure, and we will not only restrict to the thyroidectomy procedure, we will also go through all other procedures performed for the endocrine system. Okay, we will just go through them as well. Great. So before we jump into the thyroidectomy coding, let's understand the endocrine system as a whole. So you must be also knowing what an endocrine system is, because the endocrine system is made of multiple glands, and each one of these glands have its own specific function, starting with the pituitary gland. Now, this controls, this is a master gland actually, and it is located in your brain, and it controls other endocrine glands. So that's why it's called a master gland. And next we have the pineal gland, which is responsible for the sleep hormone, and it controls or it produces the hormones such as melatonin. Then we have the reproductive glands, namely the testicles and ovaries, which control the reproductive hormones. Then we have the pancreas. So pancreas main function is to regulate the blood sugar through the insulin and glucagon. And then the main topic which we are going to discuss, that is about the thyroidectomy procedure. So the thyroid gland is also important, and it controls the metabolism and other activities. Then we have the thymus. Thymus plays a role in the immunity, specifically those T cells. Finally, we have the adrenal glands also. Adrenal glands or adrenal hormones uh, are fight or flight hormones, and adrenal gland releases adrenal hormones as well. Okay, these are some of the endocrine glands, and you might see the procedures performed on one of these organs in the upcoming slides as well. Okay, now let's zoom into the thyroid and the parathyroid glands. First, the thyroid gland. Now, the thyroid gland is located in the anterior neck, and it sits just in front of the trachea. Okay, you can see the let me just pull the pointer here and show you all. Okay, you can see here is your one of the thyroid lobe, and this is the other one. So yes, it's located in the anterior neck, sits just in front of the trachea, and it has a butterfly shape. You can see it in the screen. It has a butterfly shape with two lobes on either side. Okay, and this gland is actually responsible for the metabolism. And next we have the parathyroid gland, and these are small glands which is located in the posterior or surface of the thyroid uh, gland, and usually there are four in numbers. Here we go. You can, if you can see the screen, four of those parathyroid glands, and they are also important because they plays a major role in regulating the calcium levels in your body. Okay, with that said, let's have a look into the thyroidectomy procedure CPT coding. Okay, I can see few students have also joined here. Hi, hello, welcome everyone, and glad you are all here. Okay, so all the thyroidectomy procedures are coded within the range of 60210 to 60271 in your CPT manual, and they may involve thyroidectomy for benign as well as malignant conditions. Okay, now in upcoming slides we will go and look into each of these codes specifically. Okay, just give me a moment, coders. I will have to refresh the screen. Just hang in there. All right, almost there. Okay. Okay, so let me reshare the screen. because for some reasons my on clicks were not working, and I want to make sure that it comes back and works well. Okay, great. So we are going to look into CPT code. Okay, before looking into the CPT code, I want you again to look into this image. I know our AMCI students, most of the students have this picture. They draw this picture into their CPT manual because it helps to better understand how the thyroidectomy procedures are done. So they do a rough drawing of this thyroid gland. So as I mentioned earlier, the thyroid gland has two lobes and it looks like a butterfly. All right, so you can see it looks like a butterfly, and you can think of it like also as a bow tie with one lobe on each side, which is connected together in the middle by a structure called as isthmus. Okay, so you can see one lobe on the right side and one lobe on the left side as well, and the middle portion, the structure which you see which connects both the lobes are is known as the isthmus. Now here is the important part. One lobe of the thyroid gland is equal to half of the thyroid gland. Okay, so if one lobe is removed, a half of the thyroid gland will be removed. All right, so thyroid gland has two lobes and one isthmus, and if one lobe is removed, that means half of the thyroid gland is removed. All right, is that clear? Because we are going into the CPT codes next. So we have CPT code 60240, which is coding for a total thyroidectomy procedure, total or a complete thyroidectomy procedure. And this code is reported when the entire thyroid gland is surgically removed. Okay, so it is important to remember that 60240 describe removal of both lobes, the right lobe and left lobe, along with your isthmus. So there will be nothing left. Okay, that is known as a total thyroidectomy. So if only one lobe or a part of the gland is removed, we have different codes to choose from. All right. So accurate documentation of the extent of surgery and clinical indication is essential to ensure correct coding. So that is how a total thyroidectomy looks like. So entire thyroid gland will be removed. Let's move on to the next one, which is partial thyroid lobectomy procedure code. And it's CPT code 60210 that is used for partial thyroid lobectomy unilateral. And this code is used when the surgeon removes part of one thyroid lobe rather than the entire lobe or whole gland. And it is often performed to remove the small nodules, cyst, or localized disease confined to one portion of the thyroid gland. Okay, now 60210 is specifically for partial removal of a single lobe. Now I'll just move. Yes, now this is how a partial thyroid lobectomy will look like. So only a small portion or only half of one lobe will be removed. Okay, is that clear, coders? Shall we move on to the next code? Let me know in the chat. Next, we are going to look into the CPT code 60212, and this code describes the partial thyroidectomy on one side and subtotal lobectomy on the opposite side, or otherwise contralateral side, along with the removal of the isthmus as well. Now, the term contralateral, it is important to know what contralateral is. The term contralateral means on the opposite side. Okay, so here on one lobe only a part is removed, and on the other lobe most of it is removed but not completely removed, and the isthmus connecting the lobe is also removed in this procedure. So this is how a CPT code 60212 looks like after the procedure on the right hand side, and the left hand side is what the portion that removed looks like. All right, so you can see how these images are very useful to understand quickly what happened. Next slide. Next CPT code which we are going to look is 60220, and that is for total thyroid lobectomy unilateral. And this code is reported when the surgeon removes one entire lobe of the thyroid gland, and it also may include sometimes removal of the isthmus if performed. Okay. All right, so it can be done. 60220 can be coded if isthmus is removed, or it can be also coded when isthmus is also not removed. But the important part is the one entire lobe of the thyroid gland will be removed. Now, again, you can see in the image on the left hand side is the portion that has been removed, on the right hand side is a portion that is left behind. Okay, so next CPT code which we are going to look is 60225, and the procedure involves surgical removal of one whole lobe of the thyroid gland. So you can see how it will be done. One whole lobe of the thyroid gland and most of the other lobe of the thyroid gland as well. So provider performs such surgical removal, or provider will also perform the surgical removal of the isthmus, which is the tissue connecting both of these thyroid gland lobes in the middle. And here it will looks like one side the entire thyroid lobe is removed, and in the opposite side most of the lobe will be removed but not completely, and isthmus in the middle is also removed. So it can be also called as a subtotal thyroidectomy, which means almost all of the thyroid gland is removed, but a small portion of the thyroid tissue is left behind. So you can see only a small portion of the thyroid gland will be left behind once the procedure is completed. All right. Okay, so let's us look into some more thyroidectomy procedures. We have 60252 and 60254, which is coding for thyroidectomy in case of malignancy. So if you encounter a question where thyroidectomy is performed for malignancy, a total or subtotal thyroidectomy is performed for malignancy, you can use one of these codes. So 60252 is for thyroidectomy, total or subtotal malignancy with limited neck dissection, and 60254 is for thyroidectomy, total or subtotal for malignancy with radical neck dissection. So that's the difference between these two codes. Next we have 60260, which is for thyroidectomy, removal of all remaining thyroid tissue following a previous removal of a portion of the thyroid gland. So if you have a patient who already or has a previous surgical history of thyroidectomy, is coming back to completely remove the remaining of the thyroid gland, that's when you use 60260. Then we have 60270 and 271, which is for thyroidectomy, including substernal thyroid. So the difference is that 60270 is using sternal split or transthoracic approach, while 60271 is using a cervical approach. Okay, so as I said, we will look into some more codes. These are the codes also found under the endocrine gland. We have codes for excision procedures, incision and drainage procedures, as well as removal procedures. So I'm not going too deep into them. So you can go through the code language and it's easy to understand them. Okay. And the remaining codes are for the remaining organs, like namely the procedures performed on the parathyroid, thymus, adrenal glands, pancreas, and carotid body. So I've done a little bit of chunning. It's not a big deal, a small chunning, so that I can easily recognize these procedures. So you have 60500 to 60512 for the procedures that are performed on parathyroid glands, and we have 60520 to 60522 for the procedures done on thymus gland. Then we have 60540 to 60545 for procedures done on adrenal gland. Then you have procedure codes for carotid organ body as well. Then we have some codes for the laparoscopic procedure and ablation procedures also. So this is how I classified these codes, so that quickly when I look into the CPT manual during the exam, I can quickly identify which organ or on which organ the procedure was performed. Okay, so it's time for some facts to remember from our MCG manual, from our AMCI MCG manual. So if you have your AMCI MCG manual, you can find these facts to remember in them. So it help. So we have just minimized, or we have put the guidelines in a way that you can quickly understand and quickly memorize them if needed. So first of all, whenever you see the thyroidectomy procedure, first thing which you ask yourself is it a total thyroidectomy or a partial procedure? Whether it's a thyroidectomy or a lobectomy. Next important thing to remember is that a total thyroidectomy includes two complete lobe and an isthmus removal. Okay, so everything will be removed in a total thyroidectomy, while in total thyroid lobectomy, unilateral, only one lobe will be removed. Okay, total thyroid, a total thyroid lobectomy, sorry. Okay, let's get back. Yeah, total thyroid lobectomy, unilateral, only one lobe will be removed. Then we have partial lobectomy, which means up to half of the lobe will be removed. So a half a portion of one lobe will be removed. And then subtotal means almost total. And contralateral means opposite side, or a horizontal cut. Okay. Yes. So this is the FTR which we got from our MCG manual, and it will help us while solving the scenarios as well. So that's all about the thyroidectomy procedure. Now let's move on to the next topic for today's session, which is going to be the strabismus surgery. All right. So you might have encountered patients who suffers from the strabismus condition, or you must have seen how it looks like, the different strabismus conditions looks like. So strabismus is an eye condition where the eye do not align, causing them to look different, look in a different direction instead of focusing on the same point simultaneously. Okay, so different kind of strabismus conditions are: one, you have estropia, otherwise known as inward deviation. So in estropia, one or both eye, you can see, let me once again take my pointer. Okay, so this is the estropia over here in the bottom. Yeah, estropia, one or both eye turns inwards towards the nose. Okay, and then we have extropia over here. Extropia, where the eye turns outwards or away from the nose. Also, we have something called as hypertropia over here. Hypertropia, where one eye turns upwards while other eye looks straight ahead. And finally, we have fourth condition, which is known as hypotropia over here, in which one eye turns downwards while other eye looks straight ahead. Okay, so these are the different strabismus conditions. So strabismus surgery is actually an ophthalmologic procedure which is performed to correct the misalignment of the eyes, okay, or otherwise known as the strabismus. All right, now next thing. For the accurate strabismus surgery coding, it is important, very important to know the muscles involved in this procedure. So each eye has got 6 muscles. All right, they are divided into two: vertical muscles and horizontal muscles. And this image which I got from, I think I pulled up from the CPT manual, and it is super helpful. Okay, and you can see I have done a small chunning here as well. I've done a small notation here as well, to quickly know which all are my vertical muscles and which all are my horizontal muscles. So I don't need to by heart them. I can look into this image and I can quickly recognize them as well. So your vertical muscles, there are four vertical muscles. One is superior rectus muscle, superior oblique muscles, inferior rectus muscle, and inferior oblique muscle. So these are your four uh, vertical muscle. And then we have two horizontal muscles. One is your lateral rectus muscle, the other one is your medial rectus muscle. All right. Oops. Okay. So on clicks are behaving a little bit weird today. So these are your 6 muscles that is present in your eye, and together these muscles work in harmony, so both eyes so that the both eyes will stay aligned and move smoothly in the same direction. And in coding, strabismus procedures are reported based on how many muscles are operated on and whether the surgery is done in one eye or on a both eye. Okay, so let's have a look into those strabismus surgery codes. So as you can see, these are the strabismus surgery CPT code, and these codes primarily based on, as I said, number of or the type of the muscle involved and number of the muscles treated. So starting with the horizontal muscles, we have 67311 and 67312. These are the CPT code for strabismus surgery recession or resection procedure done on one horizontal muscle and two horizontal muscle respectively. Then we have the vertical muscle code 67314, which is for strabismus surgery recession or resection on one vertical muscle excluding your superior oblique muscle. So that's an important thing which you would love to note. You should have noted that in your CPT manual. 67314 is for one vertical muscle, and also 67316. These two codes does not include your superior oblique muscle. Okay, all right, because we have a separate code for superior oblique muscle, that is 67318. You can see the below one. 67318 is for strabismus surgery, any procedure on superior oblique muscle. And then we have an add-on code 67320 for transposition procedures, any extraocular muscles. Okay, and this is our MCG FTRs once again for the strabismus surgery. First thing which you have to look while coding them is identify horizontal muscles, whether the procedure is done on horizontal muscle or vertical muscles. Next question, look out for number of muscles that has been treated here. And third one, use a 59 modifier for different eyes and different procedure. And also we have a coding tip. Each eye has 6 muscles. So coders, also watch out for the operating microscope and make sure whether you can code them along with the procedure or not. Okay. And yes, let's move on to some additional strabismus surgery codes. And these codes are mostly reported, yeah, all these codes are reported as an add-on procedure codes. And these are used in special situations and are reported in addition to your primary procedure code. So you have add-on code 67331, which is used when patient has a history of previous eye surgery, but that prior surgery did not involve the extraocular muscles. Then we have 67332, which is for strabismus surgery performed when there is a scarring of the extraocular muscles. Also, we have 67334 used for posterior fixation of the posterior fixation suture technique with or without muscle resection, and 67335 for placement of adjustable sutures. Finally, we have 67340, which is used for exploration and repair of detached extraocular muscle. Okay, so make sure you read your scenario carefully and make sure whether these conditions are performed or not, or these conditions are satisfied or not. If yes, you can use these add-on codes along with it. Okay, so now it's time to do some coding exercise on what we have learned so far. Are you ready, coders? I know you all are. So let's begin with the exercise number one. Here we go. After following answers, select the correct CPT code for this procedure. You have option A 67311, 67316, option B 61316, option C 61312, 61314, option D 67318, 61316. A patient presents to the operating room for strabismus surgery on the left eye to correct severe diplopia. During the procedure, ophthalmologic surgeon performs a recession of the superior oblique muscle and a resection of the superior rectus muscle. The surgery is completed under general anesthesia. After following answers, select the correct CPT code for this procedure. Okay, Chorus, your 2.5 minutes starts now. It's time for you to place your answers in the chat. All the best. All right, that is time, and let me quickly look through the chat. Okay. Mm-hmm. All right. All right. So let me walk you through this one. So first thing, get our inventories right. We have strabismus surgery done on the left eye. And oops, again, my on clicks are behaving a bit weird. Sorry for that. So we have the strabismus surgery on the left eye. All right, never mind. Let it be. Strabismus surgery done on the left eye. And in procedure inventory, we do have strabismus surgery done on two of your vertical muscles. We have one done on your superior oblique muscle and the one done on your superior rectus muscle, right? So it's two of those vertical muscles. You can just cross check with your image as well. Superior rectus muscle is here, that's your vertical muscle. Superior uh, oblique muscle is also here, that is your vertical muscles. Now I still might need my on clicks. Okay, now uh okay, let's go ahead and let's solve this manually. So let's have a look into option C. Option C is coding for 67316, and that is for strabismus surgery, recession or resection procedure, two or more vertical muscles. So this looks like a good code. This looks like a very good code because we have two vertical muscles, right? And it's coding for both of the vertical muscles. But if you carefully look into these brackets, it's for excluding superior oblique muscle, right? Remember that when I said 67316 does not include your superior oblique muscles because we have a separate code for superior oblique muscles, right? Okay, so I think that should be an aha moment. So 67316 is incorrect because that's not coding for your superior oblique muscle. So that makes option C wrong. All right, so let's look into our next option. I think next one in line was option B. Many of you have went with option B. Okay, option B is coding for 67311, which is for strabismus surgery, recession or resection procedure on one horizontal muscle. Okay, next question. Did we have horizontal muscle? Did we have a horizontal muscle? No, right? So if you look into this image, from what I have documented, I can see horizontal muscle is your lateral rectus and medial rectus. It's not your superior rectus or superior oblique muscle. So we didn't had any procedure done on the horizontal muscles. That is why I would say option B is incorrect. And okay, let me quickly look. Okay, someone have also selected option D. Option D is coding for 67318. That is for a strabismus surgery, any procedure, superior oblique muscle. So that's a good one. Next one is 67316. So again, 67316 is coding for two or more vertical muscles. It's more than two vertical muscles, right? So we have already, we in total we had only two vertical muscles, and one we have coded with 67318. Okay, go back 67318, and now we have only one left. That's why I would code 67314, which is for strabismus surgery, one vertical muscle, excluding. Okay, that should be also incorrect. Yeah, excluding superior oblique muscle. So that's correct. That's correct, by the way. So it's excluding superior oblique muscle. So 67314 should be coding for your superior rectus muscle, and we have separate code 67318 for strabismus surgery, any procedure on superior oblique muscles. All right, coders, it's time for you all to let me know how are you all doing. Was this an aha moment? Let me know in the chat. Okay, I can see, yes, Miss Vina said it's a tricky one. Yes, you have to be forensic little bit. Miss Tyree also said this was a little bit tricky one. Yes. Okay. Okay, we have someone who's changed to option A. I don't see other anyone picked option A for this one. Okay, so I think that was a really good scenario because you had an aha moment and that was a teachable moment as well. All right, so these are easy to score them because once you get this logic, once you understand the muscles, and once you follow our FTRs as well, it will be super easy. But be forensic while coding them. Let's move on to the second exercise, and here we go. Of the following answers, select the correct CPT code for this procedure. Option A 67311, 67316. Option B 61316. Option C 61312, 61314. Option D 67318, 61316. A patient underwent strabismus surgery on the right eye, including superior rectus recession, inferior rectus recession, and medial rectus recession. The procedure was completed under general anesthesia with post-operative care and follow-up schedule. Of the following answers, which best describe the correct CPT code for this procedure? And coders, you got 2.5 minutes to place your best answers. I'm very much confident that you all are going to get it right this time. Okay, all the best. Okay, that is time. And from what I look into the chat, I can see a few answers out there. Go ahead, coders, if you haven't placed the answers yet, go ahead and give your best answers. So I can see only one alphabet in the chat. That means you all are doing a great job. Amazing job. And that is alphabet A. Okay, so let's solve this one. These are our, forgive me for the off, my own clicks are still off. Okay, so what do we have here? We have a patient for strabismus surgery on the right eye, and the procedure performed is strabismus surgery. So let's look into the muscles. That's the first thing which we have to do. So we have superior rectus muscle procedure done on the superior rectus muscle, inferior rectus muscle, as well as medial rectus muscle. And looking into the image, I'm going to figure out which one is a vertical muscle. So superior rectus and inferior rectus, these are superior rectus over here, inferior rectus, these are my vertical muscles, and medial rectus over here, yes, over here is my horizontal muscles. So you have two vertical muscles and one horizontal muscle, right? So with that, let's look at option B first. Option B is coding for 61316, right? Okay, 61316 is coding for strabismus surgery, two or more vertical muscles. So that portion is correct, but it's only coding for the vertical muscle. We had procedure done on two vertical muscles and one horizontal muscle. So option B is incorrect. Next, option C, 61312, which is coding for strabismus surgery on two horizontal muscles, and 61314 is for strabismus surgery on one vertical muscle. Now it's exact opposite what we have in our inventory, right? We have procedure done on two vertical and one horizontal, not two horizontal muscles and one vertical muscle. It's exact opposite which we had. That makes option C also wrong. And option D, which is coding for 67318, is for strabismus surgery for any procedure superior oblique muscle. Well, when I look into my procedure inventory, I didn't have any procedure done on superior oblique muscle. So that makes option D incorrect as well. And only remaining option is option A, which is for 67311, which is coding for strabismus surgery on one horizontal muscle. Yes, there was only one horizontal muscle, and 67316, which is for strabismus surgery done on two or more vertical muscles. Yes, we had two vertical muscles in which the procedure was done, and that makes option A correct. And everyone who answered were absolutely amazing. Great job. Yes, we can also assign the RT LT modifiers in cases if you want to denote the laterality as well. Okay, yes, you can assign the modifier RT as well. It's a good question. Hello, Miss Brenda. Welcome, welcome, welcome. Okay, so let's move on to the next question. You all are doing an amazing job, coders. Exercise number 3. Of the following answers, which best describe the procedure? Option A 60220, option B 60210, option C 60240, option D 60212. A 45-year-old patient with a history of enlarging thyroid nodule in the right lobe was brought to the operating room under general and placed under general anesthesia. Neck was prepped, draped, and transverse collar incision was made lower across the front of the neck. On exploration, surgeon noted palpable nodule confined to the right thyroid lobe, while left lobe appeared normal. Right thyroid lobe was carefully mobilized with attention to protecting the recurrent laryngeal nerve and parathyroid glands. Isthmus was preserved. Once the lobe was freed, surgeon excised the entire right thyroid lobe. Of the following answers, which best describe the procedure? Okay, coders, get your key words uh, noted down and your inventory correct. Okay, once you do that, this is going to be super easy. All right, your time begins now. Place your answers in the chat. All the best. Okay, Kodas, I'm sorry. I forgot to turn on the timer. Okay, I can see some great answers. Right, I'm just looking through the comments. Thank you, Mima Gotsavo. Thank you so much. And I'm glad that you're enjoying these sessions. Okay, so in case you're still working on this, please go ahead and once you're done, you can place the answers in the chat. And meanwhile, I will just start explaining this scenario. Okay, so we have in diagnosis inventory, we have, okay, again, on clicks are off. Forgive me for that. In diagnosis inventory, we have right thyroid nodule, and procedure inventory, we have right thyroid lobectomy done. Okay, so that's what happened. And the final image which you see is what happened here. Okay, one lobe was completely removed, excise the entire right thyroid lobe. That's what happened here. Right thyroid lobe has been completely removed. So looking at the CPT codes, what do we have here? First one is 60240. 60240 is coding for a total or a complete thyroidectomy, which means both lobe and isthmus will be removed, right? It didn't happen here. As I said, we had only right thyroid lobe removed. So 60240 is incorrect. Next one is 602. Let me look which to look at next. 60. Let's look at 60220. No, 60220 must be the correct answer. So let's look at 60210. 60210 is for partial thyroid lobectomy. That means only one of the thyroid lobe will be removed. So let me try to get the on clicks right. You can see how it will be. Okay, I'm sorry, it's not working. So only one half I can show you with the help of a pointer here. Only one half in 60210, only one half of the thyroid lobe will be removed like this. So only this portion of the right thyroid lobe will be removed. Okay, and that's not what happened. We had entire right thyroid removed in this scenario. So it's also not going to be 60210. Now 60212 is also coding for partial thyroid lobectomy. So Your pattern code is, by the way, incorrect. So 60212 is also a wrong one. The correct answer is going to be 60220, which is coding for a total thyroid lobectomy, unilateral, with or without isthmusectomy. Okay, so isthmus was preserved in this scenario, and it doesn't matter whether isthmus was removed or not because 60220 codes for both with and without isthmusectomy. All right, coders, let me know in the chat. Did the explanation help? I think you all did a fantastic job. So, did the explanation help? Let me know in the chat. So, we will move on to the next question. Exercise number 4. Of the following answers, which best describe the procedure? Option A 60220, option B 60210, option C 602 sorry, option B 60210, option C 60240, option D 60212. A 45-year-old patient with multiple or multinodular goiter involving both thyroid lobe was brought to the operating room and placed under general anesthesia. Neck was prepped and transverse collar incision was made. On exploration, disease was noted in both lobes. The right lobe underwent partial lobectomy, removing only the affected portion. The left lobe underwent a subtotal lobectomy with most of the lobe excised while leaving a small amount of tissue behind. Isthmus was also removed. Patient tolerated the procedure well. Of the following answers, which best describe the procedure? Okay, coders, you got 2.5 minutes. Go ahead, and place your best answers in the chat. You all are amazing. You all are doing an amazing job in the chat, by the way. Okay, that is time. Okay, so this time as well, everyone went with one alphabet, and that makes me happy. Okay, great. So that means you all are doing a fantastic job, and this topic is clear for you all. Okay, so that makes me very much happy. Again, on clicks are off for this scenario. Apologies for that. Let's have a look into first code 60240, option C. That's for total thyroidectomy. And in inventory for this scenario, we have a right thyroid partial lobectomy. So partial lobectomy means only one half of a lobe on one side is removed. And in this scenario, it's right thyroid lobe. And Next, we had a left thyroid lobe subtotal lobectomy. Again, coders, if you remember what I said, subtotal means almost total, okay, and only a few portion will be left behind. So, okay, let's go ahead. It's not a total thyroidectomy because there were small portions left behind. So option C is incorrect. Option B, coding for 60210, partial thyroid lobectomy unilateral. Okay, this looks kind of a good code. It is coding for a part of the scenario, but it's not complete scenario because it's only coding for a partial thyroid lobectomy. Only the first part is satisfied here. Only the right thyroid partial lobectomy is satisfied here. It's not coding for left thyroid lobe subtotal lobectomy. Okay, so that makes option B incorrect. Option A coding for 60220, which is for total thyroid lobectomy unilateral. That means one complete lobe will be removed. And again, it didn't happen here, which leaves us with option D, that is 60212, which is coding for partial thyroid lobectomy unilateral. That means only a portion of right thyroid lobe is removed, so that is correct. And also, if you look into the remaining part of the code, with contralateral subtotal lobectomy, including isthmusectomy. So subtotal means nearly complete or nearly almost complete, but not complete. And contralateral means opposite, right? So exact opposite, which is left thyroid lobe subtotal lobectomy. And that's coding for yes, that would be correct answer for our scenario. Okay, so how are you all doing, coders? Let me know in the chat. Quickly, let me know in the chat. Hello, kind Troy. Hi, Sterry Sunny. Welcome back. Okay, you all did a fantastic job, coders. So let's have a quick hand poll scenario. I'm not sure how it's going to work because my on clicks are off, so it might reveal the answers first. Let's see. Okay, so subtotal thyroid dectomy means option A, is it a removal of the entire thyroid gland? Option B, removal of one lobe of the thyroid only. Option C, removal of most of the thyroid, leaving small portion behind. And option D, removal of only isthmus. So what do you mean by a subtotal thyroidectomy? Let me know in the chat. This is a rapid fire section. Type your answers in the chat quickly, fastest fingers first. Okay, okay. I'm just looking into the chat right now. All right, great answers. So there are a lot of fastest fingers in the chat now. Okay, yes, goddess. Subtotal thyroidectomy means almost every part of the thyroid will be removed, but not complete, leaving behind a small portion, right? So option C suits well. Okay, yes, option C is the correct answer. Way to go. Next one, CPT code 60210 refers to option A, total thyroidectomy, bilateral, option B, subtotal thyroidectomy, option C, partial thyroidectomy or lobectomy, unilateral, or option D is mastectomy. So if you have your CPT manuals open, quickly go us. You can have a quick look into it and place your answers. There you go. Answers are flying in the chat. Amazing job. Yes, it's option C, partial thyroidectomy unilateral. There you go. Your option C, 60210. Partial thyroid lobectomy unilateral with or without isthmusectomy. Next one, which CPT code is used for strabismus surgery involving resection or resection procedure on one horizontal muscle? One horizontal muscle. Go ahead, goddess. Yeah, you might have to flip a couple of chapters and let me know. Okay. All right. I think Starry Sunny is leading here. Okay. Great. Okay, we have great competition in the chat. Excellent job. Yes, it is option A, 67311. That is for strabismus surgery, recession or resection procedure, one horizontal muscle. Next one, I think you don't need a CPD manual to answer this. Extropia refers to which type of eye deviation? Is it inward deviation of the eye, outward deviation of the eye, upward deviation of the eye, or downward deviation of the eye? Extropia refers to. Okay, okay, you all are super fast. Great. Yes, it is option B. Extropia means outward deviation of the eye. Next one. Hypertropia. Hypertropia refers to which type of eye deviation? Upward deviation of the eye, outward deviation of the eye, downward deviation of the eye, or inward deviation of the eye. Hypotropia. Okay. Mm-hmm. All right. Okay, just looking into the answers. Great job, great job, great job. So hypertropia, it means downward deviation of the eyes. Okay, that is the right answer. And I think that's it. That's it. How did you do, coders? Let me know. Do you need more lecture videos? If you need more lecture videos, you have to do one thing for us. You have to fill out that survey form and let us know how you felt about today's class as well. Okay, so if you need more lecture videos, we have done a we have done a couple of like not couple, we have done a lot of sessions. We have now covered, I think it's the second semester. Before that also we started our CPD mastery sessions, and you can find all those videos over here in the AMCI YouTube channel. Go to the AMCI YouTube channel, and there you will find a dedicated playlist for CPT guideline mastery. So if you are currently working on your CPT section, go ahead and you will find a lot of valuable lecture videos over there. Okay, and you can see or you can view whichever lecture video you want to. Okay, that's where you will find more lecture video. And also, once again, I would request you all to please fill out that survey form. You can also let us know which topic you are looking forward to in the upcoming session. As I said, the today's topic, it was one of the suggestion or one of the request of uh, it was a request of one of the student from the previous surveys, and it helps us to plan our content that's useful for you all. And your feedback is extremely important, because only when you share it with us we will be able to know how we are doing, and also come back with more sessions and videos that is tailored for your needs. So please do take a minute to fill out that form and let us know. That's all what we ask for. Okay. All right. So, yeah, survey form is in the chat. If you enjoyed our video, please don't forget to smash that like button, subscribe, and share it with someone who needs to see it. Okay. So, thank you, coders. So, we will be back in next week, next Friday, same time, with some interesting and great topic. Till then, stay safe, keep coding, and we'll see you all next week. Okay. Please do fill out the survey form. Thank you, team. Thank you, Miss Mills. Thank you, Star Wars Girls. Thank you, Miss Tyree. Who else do we have? Thank you, Miss Catherine. Thank you, Miss Veena. Thank you, everyone. Thank you, everyone, for joining. In case I missed out anyone. Okay. See you all next Friday. Stay safe. Keep coding.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI.